Knock, knock, performing hand hygiene as I enter the room. Hi, how are you today?
Good.
That's good. I'm Rebecca. I'm going to be the student nurse working with you. Can I just have your name and date of birth?
June 30th, 2004.
All right, perfect. And can I check this bracelet? And are there any allergies I should be aware of?
No.
Perfect. All right, today all we're going to do is just go over some repositioning in bed, and then I'm going to help you sit at the edge of the bed, transfer to this chair, and work on your walking. Does that sound okay?
Yes.
Perfect. Okay, so to begin, I'm going to take your call bell and put it over here. I'm going to put the side rails of the bed down, and I'm going to make sure that there is nothing, no tubing getting caught. Everything's out of the way so that you can stay safe and we can stay safe. And in a normal setting, I would have a second person, but because of everything being online, it's just me, so I'll be pretending like I have a second person. All right, so in order to pull a person up in bed, you want to make sure that their head is flat, and you want to have a pillow. And you want to have a pillow at the top of the headboard to make sure that they don't hit themselves when you pull them up. So, you also want to make sure that underneath them you have a pull sheet. So, for demonstration purposes, this towel is going to be my pull sheet. And normally, you would have a person on either side. And I would have them help roll over, and there'd be a person there to make them feel comfortable and safe and to help with the rolling. And I shove this under, and you want it to be under their lower back. Alright, and then you help them roll back onto their back. And then she's really close to the edge of the bed. Normally it wouldn't be like this, but like I said, demonstration purposes. I'm going to be standing here, making sure that the bed is level with my hips in a normal scenario. Right now I just have like a bit of a bend to help my posture. And you're going to help her roll to her side. And I'm going to grab, well, normally the other person would be grabbing the pull sheet. And then you can help her lay back. And then you guys would both grab the pull sheet. Sometimes these have handles to hold on to. Other times you just kind of have to get a grip on the corners or on the edges. And then what you do is you say, make sure they know what they're doing. So I'd make sure that they knew we were going to pull them up, and we decide which one of us is going to count, and we have the patient cross their arms, and I always have them tuck their chin as well to make sure they're not hurting their neck. And then I'd say 1, 2, 3, and the other person and I would pull the patient up towards the head of the bed. But like I said, you want to make sure that this pillow is here to ensure that they are not banging their head. Once I would get them pulled up, I would help reposition their pillows, make them comfortable, and they can relax in the bed. And that is how you pull a person up in bed. All right, so next we're going to be demonstrating how to position a patient onto their side properly and getting them onto the edge of the bed. So to begin, a little background about this patient. We're going to pretend that they have a right-sided weakness, so that they're going to need a little extra help on that side. So at first I'm going to have her bend her knees, but she's going to need a little extra help with this right one. Then from there, I'm going to make sure that this left arm is nice and protected because she is coming over to her left side. And I'm going to place a hand here on the knee, and I'm going to place a hand right behind the shoulder. And I'm going to just roll her nice and gently, making sure I'm here so that way she knows she's safe, and reassuring her the whole time. Because a lot of times patients do feel like they are going to fall off the bed. So from here, I'm going to grab a pillow and I'm going to position it under their upper arm for comfort. That they have that. And then I'm also going to position a pillow in between the thighs to help prevent their knees from rubbing together. And then I'm also going to place a pillow behind their back, making sure that their neck and their spine all stay in a line so that way they can be as comfortable as they can be. All right, so for this next part, we are going to be demonstrating how to properly sit a patient on the edge of the bed and then get them over into the chair. So, before you begin, you want to make sure you have your wheelchair set up and that the leg rests are off the wheelchair to help prevent the patient from tripping over them. You also want to make sure you have your gait belt. This clearly isn't a gait belt, but it's what we're using for now since we don't have any. So to begin, the patient is going to have the right-sided weakness still, and I'm going to help them lower their feet to the ground, drop their legs down, and then I'm going to scoop under, making sure that this arm is protected, but also telling them that they can push off of it if they're able. I'm going to scoop under the left shoulder, go on the hip, and I'm going to just come up, and normally, like before, the bed would be at hip level, but because this isn't a hospital bed, we're just squatting a little extra. Because you want to make sure that your back's staying in a line and you're not putting that stress on your back. Once you have them up, you want to make sure you're staying in front of them. Just because they were laying down, you want to make sure they're not lightheaded. Are you lightheaded at all? Feeling good? Mm-hmm. Perfect. And you also want to make sure that their feet are in a proper stance. Then, whenever you're checked in with them and you may double check to make sure your chair is all set up, you're going to put on the gait belt. And you want this to be just right around their waist. And you never want to grab from the scooping under the arm, and you don't want to go like this. You really want to make sure that you're grabbing from their hips, and you want to make sure that the patient doesn't hang on to you like this. You either want to have them just have their arms in front of them, or tell them to push down through their arms to help you stand them up. So, are you able to help stand up? Mm-hmm. Okay, so she does have the right-sided weakness, so I am going to stay more onto the right, and I'm going to try and have my legs in a position where I could block this knee if necessary, since the right knee is more likely to buckle if a knee would buckle. So, we're going to say 1, 2, 3, and up. So once I have her up, I'm going to make sure that she feels okay. She doesn't feel lightheaded and she doesn't have any orthostatic this going on. And then from there, we're going to almost shuffle step, because you want to make sure that you're protecting them, but you're also not putting strain on your back into the chair. You want them to reach back, and then you want to gently lower them down. And you notice how I also make sure I'm bending my knee, so that way I'm not bending over like this. I'm trying to keep that spine nice and straight. So from there, I have them in the chair. Feeling good? Mm-hmm. All right, we're just gonna go right into showing you how to properly walk them with them. So when they stand up from this chair, ultimately you'd have the brakes on so that way the chair couldn't go anywhere and you'd still have the leg rest off. Like I said earlier, since she does have a right-sided weakness, I am going to stay over here whenever I stand her up. So I'm going to once again have her help push up from the chair, and we're going to go 1, 2, 3, and she's going to stand up. And then from there, I'm going to make sure, right now I'm grabbing in the center of the back with the gait belt, but I'm going to have a hand on this side and a hand on this side, and I'm going to stay slightly in back of her when she takes a step forward, but also to the side, just so that way if the patient would start to go down, I can slide her onto the floor, onto my legs, or have somebody run the chair up behind me. So we're going to just take a couple steps, making sure to stay on that right side. Yep. And just like that, that's how you properly walk a patient. For her, since she's taller than me, I didn't have to squat down. However, you are going to have instances where patients are going to be shorter than you. There, you can just make sure you're squatting down while keeping that spine straight, because you do want to make sure you have a good grip, and you want to make sure that you have a good stance the whole time you're ever moving a patient, so you're protecting them and yourself. Then at the end, I would perform hand hygiene, and I would make sure that the patient, before I would do that though, I would make sure that the patient is comfortable, that if they want to get back in bed, I get them back in bed. If they're in bed, their rails are up. If they want to just sit in their chair for a little bit, I'd make sure that they have access to their call bell, their water, anything else that they would need. And then I would perform my hand hygiene, and that would be that. So there's how you do that.